staying strong, healthy, and youthful. By subscribing, liking, and ringing, you can greatly support our channel and help us produce more content that you'll love. Hello and welcome to the Longevity Lifestyle YouTube channel. Bad breath, medically known as halitosis, is a common problem that affects people of all ages. It is an unpleasant odor that originates from the mouth, nose, or throat. Bad breath can be a social embarrassment, and it can also affect one's self-confidence. In this video, we'll be talking about the causes, solutions, and prevention of bad breath. Causes of bad breath. There are several causes of bad breath, some of which are temporary and others that are chronic. Here are some of the most common causes. Hydrogen sulfide and methyl mercaptan. The most common cause of bad breath is the release of gases such as hydrogen sulfide and methyl mercaptan from bacteria in the mouth. These gases are produced when bacteria break down food particles and other organic matter in the mouth. They are also responsible for the foul odor associated with rotten eggs and skunk spray. Tonsil stones. Tonsil stones are small, hard masses that form in the crevices of the tonsils. They are made up of food particles, bacteria, and dead cells that become trapped in the tonsils. Tonsil stones can cause bad breath, as well as sore throat, difficulty swallowing, and ear pain. Gastrointestinal problems. Digestive problems such as acid reflux, constipation, and other gastrointestinal disorders can cause bad breath. This is because the digestive system is closely connected to the respiratory system, and the odor of food can be carried up through the esophagus and into the mouth. Periodontal disease. Periodontal disease is a bacterial infection of the gums that can lead to tooth loss if left untreated. It is also a common cause of bad breath, as the bacteria that cause the disease release foul-smelling gases. Removal of foreign substances accumulated in the taste buds. The taste buds in the mouth can accumulate foreign substances such as food particles, bacteria, and dead cells. If these substances are not removed through brushing and flossing, they can cause bad breath. Medical gastrointestinal disorders. Medical gastrointestinal disorders such as Crohn's disease and ulcerative colitis can cause bad breath. This is because these disorders affect the digestive system and can lead to the buildup of bacteria and other substances in the mouth. Solutions for bad breath. There are several solutions for bad breath, depending on the underlying cause. Here are some of the most effective solutions. Brushing and flossing. Brushing and flossing are the most effective ways to prevent bad breath. This is because they remove food particles, bacteria, and other substances from the mouth that can cause bad breath. It is recommended to brush twice a day and floss once a day. Tongue scraper. Using a tongue scraper can help remove bacteria and other substances from the tongue that can cause bad breath. Tongue scrapers are available at most drugstores and are easy to use. Mouthwash. Mouthwash can help kill bacteria in the mouth that cause bad breath. However, it is important to choose a mouthwash that does not contain alcohol, as alcohol can dry out the mouth and make bad breath worse. Chewing gum. Chewing gum can help increase saliva production, which can help wash away bacteria and other substances that cause bad breath. It is important to choose sugar-free gum, as sugar can contribute to tooth decay. Professional cleaning. If bad breath persists despite proper oral hygiene practices, it may be necessary to see a dentist for a professional cleaning. A dentist can remove plaque and tartar buildup that can contribute to bad breath. Treatment of underlying medical conditions. If bad breath is caused by an underlying medical condition, such as acid reflux or periodontal disease, treating that condition can help alleviate bad breath. It is important to consult with a healthcare provider to determine the underlying cause of bad breath and the appropriate treatment. Prevention of bad breath. Preventing bad breath involves maintaining good oral hygiene practices and avoiding habits that contribute to bad breath. Here are some tips for preventing bad breath. Brush and floss regularly. Brush your teeth twice a day for 2 minutes each time and floss at least once a day. This can help remove food particles and bacteria that can cause bad breath. Clean your tongue. Use a tongue scraper or toothbrush to clean your tongue regularly. This can help remove bacteria and other substances that can cause bad breath. Drink plenty of water. Drinking water can help wash away food particles and bacteria that can cause bad breath. It can also help prevent dry mouth, which can contribute to bad breath. Avoid foods that cause bad breath. Certain foods, such as garlic and onions, can cause bad breath. Avoiding these foods or brushing your teeth after eating them can help prevent bad breath. Quit smoking. Smoking can cause bad breath, as well as a host of other health problems. Quitting smoking can help improve your oral health and prevent bad breath. Chew sugar-free gum. Chewing sugar-free gum can help increase saliva production, which can help wash away bacteria and other substances that cause bad breath. Conclusion. Bad breath can be an embarrassing problem, but it is usually easily treatable. Maintaining good oral hygiene practices and avoiding habits that contribute to bad breath can help prevent it from occurring. If bad breath persists despite proper oral hygiene practices, it is important to consult with a healthcare provider to determine the underlying cause and appropriate treatment. By taking these steps, you can maintain fresh breath and a healthy mouth. Thank you for watching, and we hope this video has been informative and helpful. I recommend that you watch all the videos I upload from the beginning to gain a comprehensive understanding of the topics covered. Don't forget to like and subscribe to our channel for more videos on health and wellness. See you in the next one.